So I just wanted to hop on and talk to you guys a little bit. So cancerousanasshole.com is my blog site, and there's a new blog up. It's titled "You're Not the Only One That Has Anxiety," although it does sometimes feel like that. It does sometimes feel like you're the only one inside the big bubble that feels like crap, that feels like the world is coming down, you're in a dark hole, and you can't get out of it. You are the only one that has the heart pounding and the sweats and the chills at the same time, and your hands are shaking, and you feel like you want to jump out of your skin. You're not the only one. Um, I know that I posted about it a few different times, but it's a very important topic. Anxiety is looked over by doctors because patients don't always tell doctors that they're feeling uh, with the fear. Because, there is a stigma attached to having a mental illness, and some people are afraid how that will be affected by them. The truth is that you're only harming yourself, because your doctors can help you if you're having anxiety. And I love this quote: "Don't ignore your emotions. It might work in the moment, but you're worse off in the long run. Ignored feelings can build up and get overwhelming as time passes on," which is totally true. They just build up and build up and build up and bottle up, and then they get worse. Anxiety is a normal reaction to cancer. One may experience anxiety while undergoing a cancer screening test, waiting for the results, receiving a diagnosis of cancer, undergoing cancer treatment, or anticipating a recurrence of cancer. Anxiety associated with cancer may increase feelings of pain, interference with one's ability to sleep, cause nausea, vomiting, and interference with a patient's family, maybe their quality of life. If left untreated, severe anxiety may cause shortening a patient's life. It can be very severe because it can cause health issues in the long run. Stress is known to cause health issues. So I feel like it is a very serious thing to talk about. That's why on the page we've talked about it a few times. I think it's serious. Persons with cancer will find that their feelings of anxiety increase or decrease at different times. A patient may become more anxious as cancer spreads or treatment becomes more intense. The level of anxiety experienced by one person with cancer may differ from the anxiety experienced from another person. Most patients are able to reduce their anxiety by learning more about their cancer and their treatment, and they can expect to receive, which is what we're trying to do here at cancerousanasshole.com. Give you guys a little sense of what to expect, what's going on. And if you have questions or people want to write in and see, oh, I have this type of cancer, maybe can, give me some types of things to expect or what it's about or just some general information. Usually that helps people just to know when you're going into the dark, not knowing, or you're traveling and not knowing. Sometimes it gives people anxiety. So if you're going to head into a direction and understand what the speed bumps are, you know what to look for. So I think that's a really great thing, and I love to do that. And I think that this is what this blog is about: giving people, letting them know what the speed bumps are. That way, when you're heading into it, you know. So your anxiety can be a little bit decreased. Like the hair thing. We had a blog up about the hair, and I had so much feedback and it was wonderful. People loved the video I had posted. Women were diagnosed and shaved their heads like I had done. It was wonderful. I loved it. It was the best ever. And oh, I'm so happy. I can't even tell you how happy I am. It was amazing to see that. Contrary to what one might expect, patients with advanced cancer experience anxiety due not to fear of death, but more often the fear of uncontrolled pain, being left alone, or dependency on others. Many of these fears can be alleviated with treatment and also knowing. Sometimes doctors, caretakers, and families don't know. It's the fear of the unknown that gives people anxiety. So ask questions. Have questions ready to ask your doctor. Write a list. Have something by your bedside or carry a book on you in your pocket and make a list what you want to ask your doctor so that you have it next time you go to an appointment. It's a great idea to do. Anxiety disorders include adjustment disorders, panic disorders, phobias, obsessive compulsive disorders, post-traumatic stress disorders, and generalized anxiety disorders. An anxiety disorder caused by other general medical conditions. And I also have a few treatment things up here, but most importantly is speaking to your doctor. I have a great coping skills checklist. It says it's for children, but deep breath, playing, with reading, cleaning, playing with a pet, maybe doing a video game, screen toys, talking to a friend, going to a fun event, doing a new hobby. All those things are great for adults also. I absolutely love this chart. Calming skills, distraction skills. I think they're wonderful, and I think adults and children could benefit from it. The one thing that I don't see a lot while researching is with teenage depression, because kids have cancer and then they go into teenage years, adolescent years, and it grows and it gets bigger and it grows and it gets bigger and it grows and it gets bigger, and then it turns into something worse. And that's what we really need to start looking at. So if you want to go and read the blog, www.cancerisAnasshole, the one thing I would ask you is to please talk to your healthcare provider. We're not doctors. I don't have a PhD. But I would love to give you some information from people who do have a PhD. And I'm just trying to get some information out there to people who may not want to research it themselves, or who's sitting in a hospital bed and wants to go on the web and just type in cancer sucks and cancer is an asshole and comes to our blog and sees that they're not alone, that other people have anxiety, and come and visit. Thanks so much. I'll talk to you soon.